Hello everyone. Thought it'd be appropriate under the circumstances to do a very brief video update, set the example of not having mass gatherings. Firstly, I'd like to thank everyone for the way you're responding to the current COVID-19 crisis. Been a really good response across the NHS, but across our organisations it's been a really positive one too. We are obviously following national advice and I hope you're keeping up to date with that. But in response to the way things escalate, different organisations will be doing different things at different times. That doesn't mean anyone's doing anything wrong or too early or too late, but it will be different. So I'm asking you all to ensure that you keep in touch with us through the daily comms mechanisms that we have in place. It is a fast moving thing. We will, as we move forward, be changing our approach. We will be taking some decisions. Some of our admin staff, for example, will be helping us in different ways, so it will require a degree of flexibility. We're also working on some important issues that have been raised by staff. We've been flagging these up through what are quite often the daily updates from the national team. Things like getting PPE sorted out to ensure that we've got a resilient supply chain to that. Also making sure that we only use PPE under the guidelines that have been issued. Also, one of the other things that will happen quite soon is moving to a situation where we have testing for healthcare workers. I'm looking to see if we can get that extended to health and care workers so that we don't have to isolate otherwise healthy staff waiting for results, so that we can get those moving quite quickly. That's something you'll hear a little bit more about over the next day or so. So thank you everyone for what you're doing. We'll keep updating you, keep looking at those emails, looking at the website to ensure that you're up to date with what's going on, and thank you very much for the professional response and for keeping yourselves and our patients safe throughout this period.